Hello, I'm Tommy Lobbin from the Johnson & Johnson Foundation and Center for Health Worker Innovation, where I lead our grant partnerships and programs supporting the resilience, well-being, and mental health of the health workforce. It's a pleasure to be here with you today, and in my role at J&J, I have the good fortune to learn every day about the ways that Johnson & Johnson employees, teams, and organizations have elevated, advocated for, and supported frontline health workers. In particular, we have long seen nurses not only as frontline caregivers, but also as the leaders and innovators that they are. And we believe that a thriving health system relies in large part on a thriving nursing workforce. The mental health and well-being of that frontline health workforce is a critical issue today. And in some respects, I'm personally encouraged that it's receiving more attention recently across all of society. And with that, I'm excited to host a conversation with you today celebrating the passage of the Dr. Lorna Breen Healthcare Provider Protection Act, a key step forward in better supporting our frontline health workers. The Johnson & Johnson Center for Health Worker Innovation and Government Affairs and Policy teams joined the Lorna Breen Heroes Foundation and others to advocate for this first of its kind legislation addressing the mental health of our health workforce and providing an immediate $140 million in grant funding directly to health systems to better meet the well-being and mental health needs of their employees. But before we get started, we've got a special message from one of the true champions of this legislation, Senator Tim Kaine from Virginia.
Hey everybody, I'm Senator Tim Kaine, and it's a real pleasure to join you. As you know all too well, physicians and other healthcare healers have long experienced high levels of stress and burnout. The COVID-19 pandemic has only worsened this problem, and the last 2 years have shed additional light on just how serious this issue is. While helping patients fight for their lives, many frontline healers have been coping with their own trauma of losing patients and colleagues, all while being fearful for their own health and safety and also the health and safety of their family members. That's why I'm such a proud advocate for the mental health and well-being of our frontline workers and other healthcare healers. We have to look out for those that spend their lives looking out for other people. My legislation, the Dr. Lorna Breen Healthcare Provider Protection Act, does just that. It provides a much-needed investment in the mental health and well-being of our healers and frontline healthcare workers. I'm so encouraged by these steps to ensure that we're caring for those that care for us, but we all know there's much, much more to be done. That's why it's so important that we continue to talk about Dr. Breen's experience and the experiences of other healthcare healers like her. Your advocacy and the advocacy of the Dr. Lorna Breen Heroes Foundation will ensure that our work doesn't stop with the passage of the Breen Act. We need to do more. So thanks to this audience for joining together for an incredible event. And thanks to Corey Feist, Jennifer Feist, and the Breen family for your tireless and inspiring advocacy.
So I have joining us Emily Boucher, our resident frontline health worker for the day. Emily is a registered nurse at Johnston Memorial Hospital in Virginia. Thanks for joining us, Emily.
Thank you so much for having me.
My Johnson & Johnson colleague, our Vice President of Government Affairs, Jane Adams. Hi, Jane. Nice to see you.
Thanks, Tommy. Great to be here.
And Corey Feist, the head of the Dr. Lorna Breen Heroes Foundation with over 20 years experience as a lawyer in healthcare. Thanks, Corey, for coming and excited to speak with you today.
Great being here.
So my first question is to Corey. So I'd love you to kick it off and have you share more about this journey that you've been on, share about Dr. Breen and the people you've met along the way.
It's wonderful to be here with the Johnson & Johnson family, and thanks for doing this, and thanks for the amazing support that you've given. So, this law bears the name of an amazing physician, my now deceased sister-in-law, Dr. Lorna Breen, but it's not for her and it's not for our family. It's for all the healthcare workers out there. So let me take you a little bit through our journey. About 4 years ago, I started to hear a drumbeat that I hadn't heard in the prior about 15 years working in healthcare, which was that this concept of burnout, this concept of moral distress, this concept of keeping down your real feelings about how you're doing was something that was becoming increasingly part of every conversation. So then came 2020. My sister-in-law, Dr. Lorna Breen, a medical director, or the medical director of the Allen Hospital, which is one of New York Presbyterian's hospitals in the New York area. Lorna was a seasoned physician, actually getting her MBA as well, trying to become an even better clinical leader. She wanted her whole career to be a physician in New York City. She literally was living her dream. And as we started as a country really hearing more and more of a conversation around this thing called COVID-19, we all thought it was going to be like flu at first, you'll remember. And then it became increasingly different than a flu. And so Lorna left us in the middle of March to go back to run the emergency department. And what happened to so many healthcare professionals, is that she became ill with COVID herself. She was never hospitalized, but she was very sick, and she tried to resuscitate or recuperate at home. And as soon as she didn't have a fever for 24 hours, she called and said, "Put me back in. It is my turn to serve." She was not equipped to do that physically or emotionally at the time. On top of that, she became increasingly aware that she was having trouble keeping up because she was incredibly depleted, because she had had COVID and probably still had many of the symptoms of COVID. But she started to express at that time that her colleagues would be able to recognize that she couldn't keep up. And that could potentially impact her career. And so we said to her, you either got to come home or get help and take a break. But she wasn't willing to take a break at the time. And she did, like so many of us, which was she just pushed through. And she pushed through for another 8 days until such time as she really needed to be medically evacuated from New York City, which was what we did. And we brought her home to Charlottesville, Virginia. She went literally from being able to take care of patients one day to being catatonic the next day. And she died by suicide on April 26, 2020. And that event for our family, like so many families who had experienced trauma, was just so incredibly overwhelming for us. And so while we were trying to grieve privately and deal with the shock and trauma privately, what we then started to hear was from the press, and everybody wanted to talk, and everyone wanted to sensationalize a suicide. So in a moment of clarity during that tumultuous time, Jennifer and I decided that what we needed to do now was we needed to step into this arena and tell her story in a very positive way, and tell the story of a seasoned healthcare worker, someone who fought her whole life for her patients and for her colleagues. And that's what we did. Senator Kaine reached out after hearing us and on TV and telling Lorna's story and said, "How can I help?" And I actually am not sure if he knew at the time that I was in the healthcare business, because the response he got had about 20 bullet points and a lot of different ideas. But those initial ideas were what started the foundation for this law that has now been signed by President Biden on March 18th.
You've touched on so many things there in that opening part, but I'd like to visit one specifically. And Jane, I'd love to ask your opinion, and through your vast and past experience on the Hill, sort of how you and your team leaned in here once you saw the opportunity emerge to be able to help Corey along.
Thanks so much, Tommy. And I also want to just applaud Corey for his courage to be able to tell his story and also follow up with how we change the environment and change the law. And I think from a J&J perspective, there was no question about wanting to help and, leverage every opportunity we have to save the lives of those who are tasked with saving ours every single day. Pre-pandemic, during pandemic, post-pandemic, these are healthcare professionals, healthcare heroes who give to us. What are we doing for them during such an incredibly challenging time, like the onset of the global pandemic? So it was not a question of, will we do this? Should we do this? It was, how are we going to do this and move this forward in a collaborative way? And because of the basis of the need for this, the inaugural bill, if you will, to start the dialogue about protections, removing the stigma, providing the resources, the connectivity to save the lives of the healthcare professionals and to provide the resources so desperately needed, was something that everyone wanted to be sure to be a part of. But then we went into actually how to navigate getting the bill heard, listened to, debated, passed both chambers, reconciled, and eventually signed into law with the great and public support of this administration.
Before we move on, Emily, I'd love for you to give you an opportunity to share what has this meant to you to sort of see this happening, hear the rumbles of legislation being put together, a lot of the stories around the developments, and then ultimately, dollars going to hospitals and health systems like the one that you work at.
Yeah, I'm very excited and relieved that this bill's passed. I've been really concerned that as the pandemic would start to die down, that these conversations would just kind of be forgotten and we would go back to business as usual. But this bill gives me hope that there's a strong foundation and an anchor that's going to keep these really important conversations going and address these issues on so many levels because, we've said over and over again that COVID didn't cause all these issues. It just magnified these issues that existed. And some of those things are having the supports that the bill provides, such as, grants for healthcare access or mental health care access and everything for healthcare providers, but also for really researching and studying what things are leading to burnout for healthcare providers and trying to change things within the system to create a better environment in general. So I'm really excited and thrilled that the bill has been passed and that I know that this is not going to be forgotten. We're not going to be forgotten just because the pandemic might start to calm down.
Emily, thank you for sharing sort of what's underneath that 140 million in terms of better understanding the root causes of burnout within health workers so that there can be a more tailored or at least scientific approach to solutions. But Corey, you've been obviously at the heart of all of this.
Every single part of this bill is really important because together what it does is it sets that first couple steps in this broad staircase that we're going to create to support the healthcare workforce from a policy perspective. The grants right now for the future workforce, those would be nursing programs and medical student programs, as well as the grants that go to support the current workforce, are really important because this is really an evolving area within the healthcare industry. And so we need a starting point to then share best practices from and really test those best practices. So right now, about 46 institutions received the first $107 million of the grants that were really inspired by this law that HRSA allocated on January 20th, 2022. And we're already working with those grant recipients to say, tell us what you're learning. Let's share that information with other organizations. Those grants are very, very important because it gave, during an economically very challenging time for everyone, but particularly hospital systems, it gave them the extra impetus to put in place programs right now to support the well-being of the healthcare workforce. So those are really two pieces of it. In addition, from an individual perspective, we need to make sure that individuals are not only aware of the issues, aware of the resources, but also have an opportunity to participate in crafting solutions. And one of the solutions that's critical here is evolving a culture in healthcare that is supportive of the individual healthcare worker, not just focused exclusively on the patient to the detriment of the healthcare worker. So that component is really, really key. We're absolutely thrilled at this progress, at these first couple steps, and more excited than ever to see how we can build this body of legislation into a full staircase that supports the well-being of the healthcare workforce.
Thanks, Corey. And just reading faces here, we'd be remiss if we didn't ask our health worker that's present with us to just share a little bit about what life is like inside those walls, right? Playing the dual role of caregiver as well as someone who's continually going through unprecedented stress.
I think sometimes as healthcare workers, we get these emails about self-care and self-help and, participating in the EAP or Employee Assistance Program, so you can talk through some things. There's also been weekly emails about different things that you can do for self-care and getting some exercise or getting outside, doing activities that you enjoy, and how important it is to take that time for yourself. And so supporting yourself along the way and not waiting just till you get to a crisis situation, and it being inclusive of everyone. Like our nurse manager was very vocal about the EAP program, about her experiences with the EAP program, and her and one of our nurse educators were really vocal about some different things they were doing for self-care. They would have open conversations with employees, how are you doing? How are things going? And so it was all of us. It wasn't just, oh, that person over there is struggling, which can be very isolating and make it feel like, that you can't acknowledge those things, or you just need to keep going, or you just need to be strong enough, or you're not measuring up if you need those things, rather than saying this is a normal part of health. This is health care. Your mental health is a part of your whole health, and everyone needs it, and it needs to be supported from the beginning, not just, oh, you're having a problem, let's intervene now.
We've got to come at this issue from a number of different angles. From a healthcare operations perspective, we cannot shift the burden of this issue to the healthcare workforce to exclusively fix for themselves. This is not, as a doctor recently told me in the Washington, D.C. area, this is not a problem that is going to be fixed by meditation apps. Okay, that was a direct quote I got the other day. And so we've got to get upstream of it. And so what I'm hearing increasingly is how hospitals and health systems are looking at ways to improve the operations, whether it's through the electronic medical record, which was the known root cause of the increased burnout of the healthcare workforce pre-pandemic, or whether it's things like team-based care, or just creating environments where the workforce can check in with each other and create a culture of well-being and just a supportive, nurturing culture. So that's really, I think, a real important concept here.
Corey, I mean, you speak with the fire of a man who's not done. And I think we're all in your camp in that sense. So I'd love to take us into what's next.
From an awareness perspective, we really need to amplify the conversation, create a community across healthcare conversation that it's okay to get help, so that people understand where the resources are, and that there's a clear connection made and an understanding made between the operations and the workforce. The second area is in solutions and advancing solutions. And we've partnered with Johnson & Johnson to launch a nationwide initiative called All In Wellbeing First for Healthcare. The website allinforhealthcare.org is where all of our resources are housed. We're taking a systems-based approach here on the All In network. We've created a cross-healthcare set of steering committee members, everyone from the AMA to the American Nursing Foundation to the Filipino Nursing Foundation to the National Black Nurses Association. The list goes on, but we've tried to be very inclusive on our steering committee and help knock down silos, because this is everyone's issue, and the issues and the solutions are very similar, though not identical. In addition to that, we've launched a fund for All In, and we're funding organizations, and we're really thrilled that we're going to be partnering with Johnson & Johnson to develop a nurse hackathon, where we're going to be looking for additional ideas that we can help fund in those areas.
Yes, the J&J Foundation is certainly proud to be a founding partner of the All In campaign and fund. And we're even more excited to announce our recent collaboration with All In on our Nurse Hack for Health Pitchathon. You can find out more information at nursehack4health.org. Applying teams will be eligible to receive grant funding of up to $250,000 to accelerate well-being resilience interventions at their health system. Emily, a slight twist on the question for you, just again, our nurse for the day, you hold such an important and valuable perspective. How can the health system continue this moving in the right direction and not regressing after this?
I think as a healthcare provider, and Corey, you sort of addressed this, but I do agree. You can get emails and see posters all over about self-care and take care of yourself. And sometimes that can feel like, yeah, right. I'm working in a system that's not allowing me to do my job, or where I feel so overwhelmed. I feel like I can't, properly provide for patients. And that's why I think this bill is so important, because I think in healthcare, whether it's assumed or spoken, sometimes you can develop a mentality of, I just have to put my head down and keep going. I have to keep being strong and keep getting it done. Um, and then people can be looked at as being weak, or they just couldn't handle it, or whatever, if they're seeking out mental health, or if they get burnout and leave, which is another tragedy of burnout, is that you lose so many excellent providers just through, I can't do this anymore, I'm quitting, and I'm going to go find something else to do. And that impacts the healthcare that everyone in the nation is receiving. When you have providers leaving left and right because they don't feel like they can properly care for their patients in the environment that they're in, because they just have too much on their shoulders and can't properly do their jobs, and they leave, you're losing providers, but you're also losing quality providers and quality care. And I think this bill is so important because it does provide actual mental health services and encourages more EAP programs and grant funded programs and everything to provide services that are needed. Yes. And more importantly, to open up that conversation and normalize that conversation, that it's not just about people who can't hack it. It's all of us, and we're all in this together. And we need a system that will provide an environment that protects healthcare workers and gives us an environment where we can function in the role that we were passionate about when we decided to get into healthcare in the first place, and taking care of people. It will protect us from burnout and provide knowledge and resources so that system changes can occur and we can be fulfilled in those roles, and in turn provide excellent evidence-based care to our patients as well.
So, in closing, I'd like to open it back up to our panelists to see if there's anything else to share, if we've sparked any other thoughts or conversation or pieces missed.
I would encourage everyone that if you have the opportunity to talk to somebody, it doesn't have to be that you're at a crisis point and that they need to fix some major issue in your life just for anxiety or depression or whatever. It can be for those things, but it can also be that sometimes it's just good to be able to sit down and talk to somebody who's outside of the situation that you're in, and just kind of talk through some things and maybe even come up with some ideas for solutions that can make that environment better.
It's such a great point, Emily. And I would also add just one, that the collective we, need to be okay with asking for help. And again, we talk about stigma. Also, advocacy makes a difference. One person turns into 2 people and 4 people, and voices multiply and passions come out and stories are told. And it can make a difference, evidenced by trying to make something good and needed happen from a terrible, unnecessary tragedy. So I would also, just from an advocacy standpoint, want to encourage anyone who's listening about, when you see change that's needed, you as one individual have that power to bring your story and to bring that issue forward and go from there and look what can happen.
You have a voice. You have a strong and powerful voice. Be vulnerable. I've cried, I think, on national television now more than I ever thought I'd be on national television. But use your voice and use your power, because you can make an impact. If we've learned anything, it's that. And the last comment I would make, along the lines of what Emily was saying, if you think you are in crisis, or you see someone who just is having a bad day or may be in trouble, don't wait to see if things just naturally resolve. Tap them on the shoulder, ask them how they're doing, and then ask them again, how are you really doing? Something as simple as that can really have an incredible impact on yourself as well as your colleagues. And I think what it also does is it helps to build the culture that I think we all probably want for healthcare for the future. So I want to thank again Johnson & Johnson for the incredible partnership, Tim Kaine, Senator Young, and all the cast of bipartisan supporters, associations for helping us move this bill into the first ever law supporting the well-being of the healthcare workforce.
Well, thank you all, Corey, Emily, and Jane, for joining me in this very meaningful and poignant conversation today. So thanks, and I hope you all have a good rest of your day.